Back pain can be absolutely horrible, and unfortunately, it's pretty common. Probably the #1 complaint we have coming into the office is low back pain. And it goes to show low back pain is currently the #1 cause of disability in the entire world. So what are some things that you can do to help improve that area? Well, let's go through it. Before we start, let's talk about what area of the back we're really worried about. Mostly the low back. So these are the bones in your spine. This is with all the muscles and all the fun stuff ripped away or removed. Now upper, middle, lower, right here is what we're focusing on is the lower back or the lumbar spine. 5 bones here, hips, sacrum, really important area. This area right here supports about half your body weight. So when you have issues here, it can create all other sorts of problems. What can we do to improve this? Well, one of the first things to understand is that area, this area in the low back, is designed more for strength, not mobility. This shouldn't be a super flexible area. Most of that should be coming from the hips. So a lot of what we're going to talk about in here is ways to improve strength here and mobility in different areas, because that's really what we run up to an issue with. But first, let's start with something simple. There's a good chance that you're watching this video either at your desk or hunched over on a cell phone. That's probably one of the first and easiest things that we can work to correct, is making sure that people have proper posture. Understanding that when you're bent over on your phone like this, I mean, even seeing right there, can you see how that would put extra pressure on the back? Think of it, if you've got a bowling ball up here and you extend that out, it makes it tougher on the arms. That same thing goes on in your low back. As you extend further and further, this gets heavier and heavier. So making sure you're trying to keep a good, upright, strong posture at all times, and that you're constantly staying moving. There is a lot of talk about how standing desks were going to be phenomenal, and it followed just after for sitting on a physio ball was going to be phenomenal. What we found is that as long as you're changing position, that's the most important thing. You can have a standing desk and still be hunched over like this and causing issues. The most important thing is to be cycling through and not sitting for hours at a time, focused on one thing. Even if it's something as simple as getting up every 20 minutes and taking a quick walk around the office, your desk, or around the kitchen table, just something to keep your body moving. You're not designed to be hunched like this for hours upon hours at end. And that doesn't matter if you're sitting at your desk, sitting on a couch, or sitting hunched over your phone. This is going to cause problems. And everything else that we're going to talk about will only take a few minutes a day, but if you're spending hours a day like that, you can see how it's not going to work out so hot for you. So when we talk about strength in this area, one of the easiest, simplest activities we can do for this is planking. Now, depending on what your level of physicality is, you can do this in a number of ways. We've had some of our older patients that just going up against a wall with their elbows like that and then slowly working down is huge. Now, for some of our younger patients, doing that same activity but on the floor for a planking exercise, really simple and easy. Start these out at 30 seconds, move up to a minute, and then you can do on your center and then one side and flip over and the other side. 30 seconds each to a minute each takes you 1.5 to 3 minutes. Real simple, quick, easy thing that you need no equipment whatsoever to do. And frankly, these aren't even bad exercises to do during the middle of the day at work. In your office, just go down 30 seconds. It's a good way to activate things, get things moving the way that they're supposed to. So that's one real quick, simple, easy way. The other is we're going to talk about mobility. Most of that mobility that you have should really be coming from your hips. When you turn one way or the other or bend down, as you notice, that's all coming from my hips. When you're rotating back and forth like this or bending down like this, you notice that's all coming from my low back. Those aren't the best motions for that area of your spine. So a real simple, easy way to improve mobility in the hips. Now, if you've done any cross country or track workouts, this might even be familiar to you. It's a hip opening and closing. You just stand up, over, down, and then the other leg. Up, over, down. Minute for one, and then the opposite way. Over, up, down, over, up, down. Just minute going each way, back and forth. Set a timer, your phone has one, or if you want to count a number of reps, whatever. Real simple, quick, easy way to improve mobility in the hips here. It's a fantastic activity. It's really simple. You don't need any equipment to do. And again, we're now even on the long end talking at about maybe 5 minutes for what we've had to do so far. So again, some quick, simple, easy ways. One, try to maintain a good, strong, upright posture. Next, make sure you're really doing stiffening exercises, really to increase the strength of this area. Next, mobility here in the low or here in the hips to spare the low back from those from that mobility exercises. You want really that coming from your hips. Now, another one is just to improve your overall health and wellness. If you have 40 pounds pounds hanging over your belt, that's going to put pressure on your low back. And not only that, all the adipose tissue, the fat there, creates a lot of inflammatory chemicals that makes any problem even bigger. So the more that you can do to try to be healthy, to maintain a healthy weight here and really throughout your whole body, not only is this going to help with back pain, but this is going to help with overall inflammation, overall health and wellness. Really interesting studies coming out, especially with men, talking that one of the biggest precursors for Alzheimer's later on in life is belly fat. So while we're looking at this right now for low back pain, long-term mental health and awareness, acuity, makes a huge difference for that as well. So that's another simple, easy thing that you can do. The last, and this is again, real simple, easy, it might take a little bit longer, is just go out for a walk every day. It can be short, can be long, 15, 20, 30 minutes. Go for a run. Just do some sort of physical activity to get your body out and moving. The more you can do that in nature without your phone, without anything else, the better. Just kind of allow not only for your body to exercise, for things to move, but also for your mind to quiet, for you to have just a little bit of relaxation and kind of get back to yourself. This is phenomenal, and especially in patients with chronic pain, is sometimes we get so focused on what's wrong that we have a hard time seeing what's right. And this time to be outside, to be active, to be moving, it doesn't need to be huge. And of course, be smart. If you have a tough time walking more than 5-10 minutes, don't go for a half-hour walk. But again, start slowly working up to that. You know, every day, just do a little bit more, a little bit more, a little bit more. Small hinges swing big doors. Little changes can make big differences. So thank you very much. Hopefully this helped. Have a wonderful day.